Okay, I'm a hematologist and I have had special training in hematopoietic stem cell transplant, or commonly known as blood stem cell transplant or bone marrow transplant. I also have a special interest in treating acute leukemias. I also treat other malignancies like lymphoma, multiple myeloma, and myelodysplastic syndromes. I'm an adult hematologist, so the most common blood cancer in adults is actually acute myeloid leukemia, as well as conditions like myelodysplastic syndrome, which is related to acute myeloid leukemia. It's sort of like a pre-leukemic condition of the bone marrow. Many of these diseases require a blood stem cell transplant to be cured. So HSCT, or hematopoietic stem cell transplant, is something which we have started to do in Raffles Hospital since I joined Raffles Cancer Centre in January this year. One of the most common blood cancers in adult patients, which is what I mainly treat, is acute myeloid leukemia and also myelodysplastic syndromes, which are sort of related to AML. I also see acute lymphoblastic leukemia and some other blood cancers such as multiple myeloma and related conditions like this. Well, first of all, in Raffles Hospital and in Raffles Cancer Centre, we have other hematologists and oncologists working with us. And Raffles Hospital being a hospital with many disciplines, patients also have access to other specialists that are needed in the treatment of patients like this. So, for instance, they have access to infectious disease specialists, they have access to surgeons or gastroenterologists if they need it, as well as a well-trained intensive care doctors and nurses. This, together with the team of transplant coordinator, oncology trained nurses, both in the Raffles Cancer Centre as well as within the dedicated transplant unit in Ward 9 of Raffles Hospital, means that when patients come, they will be able to be taken care of in every way. It will be a holistic approach towards caring for patients. There are a number of blood cancers that are mainly curable only with a blood stem cell transplant. So when they come to Raffles Hospital, what they have access to is not just a dedicated transplant team and a transplant unit, but they also have access to all the various specialties that are present in Raffles Hospital. So for instance, they can have access to infectious disease doctors, they can have access to gastroenterologists and surgeons if they need to have procedures like that. And they also have access to intensive care unit with well-trained intensivists as well as a well-trained ICU team of nurses. So in this way, when they come to Raffles Hospital, they can ensure that whatever issues they may encounter in the course of their blood stem cell transplant treatment, they will be able to be taken care of in a very holistic manner. Patients, before they come to see us, we need to ensure, of course, that the diagnosis is made appropriately and accurately. So we would want to review all of the patient's records beforehand to ensure that diagnosis has been made well. And then we will advise them for the treatments that are required based on the diagnosis. So for instance, when patients come to us, they don't just step through our doors and say, we need a transplant. Let's just say they have a condition like acute myeloid leukemia. We want to make sure that the diagnosis in the first place was made accurately. So we want to review their histology, review the bone marrow aspirates, and so forth. Most often, the patients may come, they may have already received 1 or 2 cycles of chemotherapy, and we may continue the treatment in Raffles Cancer Centre even before we proceed on to the blood stem cell transplant, because we need to find an appropriate donor for them. We will advise patients who are coming to Singapore to seek treatment to have access to all their records so that we can review them, sometimes even before they come to Singapore, to ensure that diagnosis and treatment has been made appropriately. Also for patients coming, we would want them to bring along their family so that we can explain to them the treatments that are required, and the family can also be involved in supporting the patients through the transplant journey that can be quite long and sometimes quite difficult for them. The patients may also sometimes come maybe needing further cycles of chemotherapy even before their transplant. In this situation, we want to continue the treatment appropriately, even as we search for a blood stem cell transplant donor for them. Well, I think that this team that is with me didn't just come with me from Gleneagles. In fact, they came with me from another hospital, from SingHealth. So I've been working with them for quite a few years now. So we know each other, we know each other's working styles, we know each other's strengths and weaknesses. and that helps us to work together in a cohesive team. One of the challenges we face, of course, is when we import a whole team to join the existing Raffles Cancer Centre, we have to learn to adjust to each other as well. But one of the benefits is that when I join Raffles Cancer Centre, I actually am joining on with three specialists that I've worked with before, from Singapore General Hospital before from years ago. This helps us to integrate more smoothly. We've had to also familiarize the nurses in the ward with the treatment protocols for hematology as well as for blood stem cell transplant. And then since the beginning of the year, we've already done 6 patients, and that has helped the team and the nurses to also pick up and learn the skills that are required in nursing blood stem cell transplant patients. They have in fact been guided along by the transplant nurses that followed me over from Gleneagles Hospital. So in this way, working in partnership, we've been able to help to train the nurses in the ward, and I believe that as we continue to do that, we can aim for even better and better outcomes. Well, I didn't just move from Gleneagles Hospital with this team. In fact, I've been working with them even ever since I was in Singapore General Hospital, and they've moved with me, and they've worked with me for quite a number of years. This means that we know each other's strengths and abilities, as well as our weaknesses, and so we're able to complement one another and work together as a team. In addition, I joined Raffles Cancer Centre. I'm working with specialists that I've worked with before when we were all together in the SingHealth cluster. So even though there's some adjustments to each other's working styles, we've actually been able to integrate nicely because we have similar training and background from before. Now, as we've moved to Raffles Hospital, we've also been able to work in partnership with the inpatient nurses. I've conducted courses to train them, and they've also been able to tap on the experience and the knowledge of the existing transplant nurses that came along with me, and this enables us to be able to build a team up together as we grow. So in fact, we've already done 6 transplant patients since we came in January, and I believe that as we continue to work together and gain from each other's experience, that we can aim for even better and better outcomes. I think one of the most important things is making sure that you get the diagnosis accurate and appropriate so that the best treatment can be recommended. And when you have a diagnosis of a life-threatening condition like leukemia or lymphoma, you want to make sure that this is made appropriately. So sometimes what it may mean is having your histology reviewed in Singapore, and we're happy to help you with that. And even if the recommendations for treatment are similar to what your doctor has given you back home, then you can even return to your home country to continue the treatment. And we're happy to work together with the doctors in Vietnam to ensure the best possible treatment outcomes for patients. In fact, I do make it a point when specialists from Vietnam have referred patients to me that I will always refer them back with a full medical report so that they can continue to follow up the patients. Because the transplant journey doesn't just end after 3 or 4 months in Singapore. They actually have to be followed up, in fact, for lifelong. So every month or every few months they need to see a doctor. So I'm very happy to work with specialists that I know in Vietnam in order to ensure that they can continue to be looked after and receive the best care possible.